Infectious diseases are notorious for their ability to spread rapidly and cause widespread health crises. Among these, HIV, AIDS, malaria, and Lyme disease stand as significant public health challenges across the globe. Each year, these diseases claim millions of lives, affecting people from all walks of life, irrespective of their age, gender, or socioeconomic status. The impact of infectious diseases extends beyond the immediate health consequences, disrupting economies and placing immense pressure on healthcare systems. HIV, first identified in the early 1980s, has since led to the deaths of more than 32 million people worldwide. Malaria, an ancient disease, continues to affect hundreds of millions annually, predominantly in tropical regions. Lyme disease, though less widespread, has been increasing in prevalence, particularly in parts of North America and Europe. Understanding these diseases is not merely a medical necessity, but a global imperative. The symptoms and effects of these diseases vary significantly, but they share commonalities in the way they devastate the body's systems and complicate the lives of those affected. HIV/AIDS is caused by the human immunodeficiency virus, HIV, which is transmitted through unprotected sexual contact, sharing needles, or from mother to child during childbirth or breastfeeding. Once inside the body, HIV targets the immune system, particularly the CD4 cells, T cells, which are crucial in fighting infections. As the virus replicates, it gradually breaks down the body's defenses against infections and diseases, leading to acquired immunodeficiency syndrome, AIDS. The symptoms of HIV can vary, but they often include fever, sore throat, and fatigue. As the disease progresses, more severe symptoms such as weight loss, persistent diarrhea, and opportunistic infections can develop. These symptoms drastically reduce the quality of life and can lead to premature death if not properly managed with antiretroviral therapy, ART. Globally, about 38 million people are currently living with HIV, with sub-Saharan Africa being the most affected region. Despite significant advances in treatment, HIV continues to be a major global public health issue, reflecting the need for enhanced public health strategies, more accessible healthcare services, and continued education on safe practices. Prevention efforts for HIV include safe sex practices, regular testing, and treatment adherence. Understanding and implementing these can dramatically reduce the transmission of the virus and improve the life expectancy of those infected. The importance of these strategies cannot be overstated in the fight against this relentless disease. Malaria is an infectious disease caused by Plasmodium parasites, transmitted to humans through the bites of infected female Anopheles mosquitoes. Once in the human body, the parasites multiply in the liver before infecting and destroying red blood cells. The cycle of fever, headache, chills, and vomiting typically begins 10 to 15 days after the initial mosquito bite and can recur in milder forms every few days. In 2019, there were approximately 229 million cases of malaria worldwide, with the majority of cases and deaths occurring in Africa. Children under 5 years old are the most vulnerable group, accounting for about 67% of all malaria deaths. The economic impact is profound, especially in Africa, where it is a major hindrance to economic development, costing billions of dollars in healthcare costs and lost productivity. Preventing malaria involves the use of mosquito nets, indoor spraying with insecticides, and preventive medications. Public health campaigns focus on eliminating standing water where mosquitoes breed and improving sanitation and community health education to reduce the incidence of this deadly disease. The international community continues to invest in vaccine research and improve treatment protocols to combat malaria. These efforts are vital to reducing the global burden of the disease and enhancing the quality of life for millions of people in endemic regions. Section 4. Lyme disease, an emerging concern. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted to humans through the bite of infected black-legged ticks. Typically, the first sign of infection is a red rash, often resembling a bullseye on a dartboard, followed by symptoms including fever, headache, and fatigue. If left untreated, the infection can spread to joints, the heart, and the nervous system, causing more severe and long-lasting symptoms. In recent years, Lyme disease has been reported with increasing frequency, particularly in the United States, Canada, and Europe. Changes in land use, such as the increasing interface between suburban areas and forests, and climatic factors are believed to contribute to the spread of ticks and, consequently, Lyme disease. This trend highlights the need for increased vigilance and preventive measures in at-risk populations. Prevention of Lyme disease focuses primarily on avoiding tick bites through the use of insect repellent, wearing long sleeves and pants, and performing regular tick checks after spending time in wooded or grassy areas. Public health efforts also include educating the public about the proper removal of ticks and the importance of early treatment, which can significantly reduce the risk of severe complications. As Lyme disease becomes more prevalent, understanding its transmission, symptoms, and effective prevention methods is crucial. This knowledge empowers individuals to take proactive steps in protecting themselves and helps healthcare providers to diagnose and treat the disease more effectively. Section 5. Prevention strategies for infectious diseases. Preventing infectious diseases like HIV, malaria, and Lyme disease involves a multifaceted approach that includes education, community involvement, and personal protective measures. Education plays a pivotal role in prevention, as understanding how diseases are transmitted can significantly reduce the risk of infection. Community involvement is also crucial in implementing effective prevention programs that can reach a wide audience. Personal protective measures vary depending on the disease, but generally include using condoms to prevent HIV, mosquito nets to guard against malaria, and insect repellent to protect against Lyme disease. Regular medical checkups and vaccinations, where available, are also critical components of disease prevention. Public health campaigns are essential for raising awareness about these diseases and their prevention. These campaigns can provide vital information on symptoms and treatment options, encouraging early diagnosis and treatment, which can greatly improve health outcomes. The role of international cooperation in combating these diseases cannot be underestimated, as diseases know no borders. By integrating education, community involvement, and personal protective measures, we can create a comprehensive defense against these infectious diseases. This integrated approach not only helps prevent disease, but also promotes a healthier, more informed society. Section 6. Conclusion: the power of awareness and early action. The battle against infectious diseases such as HIV, malaria, and Lyme disease is ongoing and requires the concerted efforts of individuals, communities, and governments worldwide. Awareness and early diagnosis play a crucial role in managing these diseases, preventing spread, and minimizing the impact on the affected populations. By understanding the causes, transmission routes, and symptoms, individuals are better equipped to take preventive measures and seek treatment early. Public awareness campaigns and education are vital in changing perceptions and behaviors related to these diseases. They help dispel myths and misconceptions that can hinder prevention and treatment efforts. Moreover, early diagnosis leads to better treatment outcomes and can prevent the severe consequences of these diseases. As we continue to advance in our medical capabilities and knowledge, it is imperative that we also enhance our efforts in education and prevention. It is only through collective action and responsibility that we can hope to reduce the burden of these infectious diseases and improve public health on a global scale. Understanding infectious diseases is not just about scientific knowledge. It's about empowering people to make informed decisions about their health and the health of their communities. Through continued education, prevention, and timely action, we can tackle these health challenges and pave the way for a healthier future.